Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and your community. Thank you for joining us today. You are listening to Mahaska Health Medical Minute. My name is Renee Edgar, and I'll be your host for this episode. Today, talking about vaccines is Patty Malloy, Public Health Coordinator at Mahaska Health. Patty comes to us with 30 years of experience as a registered nurse and as someone who has worked closely with the Iowa Department of Public Health. She has a true passion for preparedness education and truly fulfills her responsibilities with excellence, compassion, and a vision for the future. It's quite the intro, Patty, isn't it?
That is.
Patty, thank you for coming on the podcast today. I believe a lot of our listeners would appreciate hearing a little bit more about your background and your current role at Mahaska Health.
Yeah, I've been a nurse here at Mahaska Health for over 30 years. I started out in medical surgical and kind of worked my way through a few departments. I did some inpatient and cardiac rehab and ICU. And then about 20 years ago, I started home health and public health. So 10, 12 years ago, I started with public health, full-time public health coordinator. So that has been wonderful. I really enjoy every day is a different day, that's for sure. And just working with the community and different things that we do as public health. So a lot of times people don't really know, I don't think, what public health does. We're kind of behind the scenes. We like to be behind the scenes because that means our job is going well and we're doing well. So a lot of what we do is, promoting vaccines in the community, in the childhood population mostly. And then we also do public health preparedness. So that's been something that's been really a hot topic since 9/11. So those are, we have coalitions and meetings with the Iowa Department of Public Health monthly and prepare for events like this. We've talked about pandemics, and we had H1N1 in the beginning of when I started doing public health, and learned a lot through that. It was not at the scope at all, but again, it was things that we learned from. So,
Great.
And we also do communicable disease investigations.
It's a mouthful.
That is, yeah.
So last year, 2020, was a year that took us all by surprise. You and the rest of the team in public health had a major shift in your daily responsibilities as you have worked diligently to both research and communicate necessary information pertaining to COVID-19, all while you were navigating this healthcare climate. Now the community is seeing hope in the recent released COVID-19 vaccinations. Could you give us an update on how this is being implemented in Mahaska County? How is the vaccine given, and who is going to be the first in line to receive it?
Yeah, I think getting the vaccine was a game changer in a lot of ways. We were excited to have it now in our hands, and the CDC sets guidelines for the federal government. Those guidelines come from them, and each state is given an allocation of so many doses, and those doses are divided by the counties, so through your local public health. And there were different methods that people could sign up the long-term care with their pharmacies, like CVS, Walgreens, and community health pharmacies is what the long-term cares are seeing, and that's what's happening in our community. And then public health was allocated doses for the 1A, so they could kind of categorize who can receive it at that now because of the limited amount we have. So as it's being produced, the CDC is sending it out to the states, and the state is allocating it to the different counties. So 1A is where we're at now, and that's the beginning of getting the vaccine into people, and it's given to those frontline care workers that come to work every day and have to deal with COVID or take care of a COVID patient, and that's kind of their task. So we want to make sure our healthcare system, from the beginning of this, we've said we don't want to have a surge on our healthcare system, and so this is a tool of many that we can help in that. So we still, I know we're hearing a lot about people wanting to know when they can get it, and we're still, waiting for that information. But for now, it's that healthcare staff that work with patients that they can't screen from an appointment. They're sick. They need to come in and have health care. And so they're the ones that are getting the vaccine in this initial phase.
Patty, do you happen to know approximately how many individuals in Mahaska County are frontline healthcare workers who have received the vaccine?
Yeah, currently from the numbers that I saw this afternoon about noon, we had about 213 that it shows have been vaccinated. And we know that 170 have been workers here at Mahaska Health. So, that's a great start. We need to continue to reach out to the frontline care workers. If you're not associated with the hospital, then get a hold of your public health or whatever county you work in. It's not really restricted by county, but if you live here but work in another county, you can get the vaccine either place. But just ask, the frontline staff is those workers who work directly with COVID patients.
So as we look towards the future, as we need to keep living, we'd love to discuss what the vaccine will look like once it's available to the general public. That being said, what's the current plan for releasing this vaccine to the community, and what might we expect from it?
One thing I just want to mention is that Mahaska Health is a very safe place to come and be seen by your providers. Just give us a call. We want to be there for you. As we move through the different tiers and things open up for more people to get it, Public Health will be holding vaccination clinics. We're going to do it by appointment just because we still want to make sure that everybody's safe when they come in and we don't have too many people in one space. So we have an area here at Mahaska Health at door 1 where we'll be doing the vaccination clinics. So we've been planning for that for several months. Now that it's here, we're working through that for the employees and then for the frontline workers that come in from other areas. And then when we start doing more public vaccination, that will be set up and ready to go.
Thank you so much, Patty, for sharing your insights and expertise with us today, and generally all that you have done for the community of Mahaska County. It's very apparent you take great pride in your work. If you'd like to stay updated on information regarding the COVID-19 vaccination, stay tuned to Mahaska Health's Facebook page, YouTube channel, and website for the latest information. Mahaska Health is dedicated to caring for you. We have excellent providers who are ready to craft healthcare goals uniquely for you. Same-day appointments are available, and our walk-in is open from 7 a.m. to 7 p.m. Monday through Friday, and 8 a.m. to 4 p.m. on Saturday and Sunday. Our telephone number is 641-672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.